I'm Barbara Kennelly. I'm president of the National Committee to Preserve Social Security and Medicare. I represent over 3 million members and supporters across this country. They come from all walks of life, but what they have in common is their passion to protect Social Security and Medicare, the cornerstones of our income security for retirement. We've heard an awful lot about grandmothers this summer and yesterday. I'm a grandmother. I have 10 grandchildren. I grew up in Hartford, Connecticut, and I can remember before 1965 when there was no Medicare and half of seniors had no health care whatsoever. What happened was, and don't forget, Hartford, Connecticut is the home for the Hartford, the Aetna, the Travelers. So I know a little bit about health insurance. But what happened when we had Medicare legislation in 1965 is they put all the seniors in a risk pool, and they shared the risk. And as a result, we have the Medicare program, which has been a marvelous success, and seniors have been the only ones with universal health care. Unfortunately, now Medicare is caught up in the same inflation that has made health care for the rest of the country unaffordable. Medicare uses the same doctors, the same hospitals, the same MRI machines as everyone else, so it is caught up in skyrocketing costs. We simply must slow the increasing costs of health care if Medicare is to remain viable. The McCain Amendment doesn't move us 1 inch in that direction. Protecting Medicare and Social Security has been the National Committee's mission for the last 25 years, and it's still our top priority. I can assure you, my members are no different than seniors all over this country who are nervous about the future and are very concerned about what is in these health care bills. And another time and place, I would agree with them. In fact, I travel all over the country, and I talk to seniors, and the one question I constantly get is, Barbara, how can you take $500 billion out of Medicare and not hurt the program? And this is a legitimate concern, but it ignores how massive the Medicare program is. The federal government will spend about $9 trillion on Medicare in the next decade. All the Senate bill does is trim this growth by 2%. Frankly, if we can't cut Medicare by 2%, we are not very good managers. In addition, the savings of the bill are designed to protect beneficiaries, and the amendment offered by Senator Bennett, who, by the way, was born in Connecticut, expressly prohibits any reductions in guaranteed Medicare benefits and makes sure all savings are reinvested in Medicare. Let me repeat that, because it is important. The Senate bill expressly prohibits any reductions in guaranteed Medicare benefits and makes sure all savings are reinvested in Medicare. This is especially important for hospitals, the trust fund, which will only have enough money for the next 7 years. The Senate bill almost doubles the remaining years of solvency. The McCain Amendment, it may be well-intentioned, but I listened to the debate yesterday, and I'm not so sure about it. But I do know it does not improve the Medicare program. It does nothing to slow the rapid growth of Medicare, either for seniors or the federal government. It doesn't reduce the cost of prescription drugs, which have grown by 9% over just the last year. And it won't help seniors keep their doctors by making sure they don't see a 21% pay cut. Medicare changes can be frightening to seniors because they rely so much on these benefits, and they have nowhere else to go if they lose Medicare. Most simply, they have to have their Medicare program. But today's seniors are also the generation that witnessed the creation of Social Security and Medicare, landmark laws that triggered similar fears, but which have sustained generations and hopefully for the future. I believe, gentlemen, that we are blessed with precious few opportunities to make a positive impact on millions of people. Enacting health care reform that strengthens and improves Medicare is one of these rare opportunities. Every bill can stand improvement, but the McCain Amendment, by ignoring the problem and stripping out all the Medicare provisions in the Senate bill, is not the answer. Doing nothing will hurt seniors today and will leave our daughters and our granddaughters without health care and without Medicare. Thank you very much.